Hello, friends. Welcome back to the Global Health Unfiltered podcast. We're your hosts, Desmond Jumbam and Yao Bediako. A few weeks ago, the BBC published a deeply disturbing documentary about the horrible atrocities committed by TB Joshua, the late Nigerian televangelist. The documentary showcases the fake miracles, sexual exploitation, manipulation, abuse, and other violence that was committed by the televangelist. Over the years, thousands of people with various health conditions have flocked to him and his disciples for healing in Cameroon, in Nigeria, and other places. So today we are happy to invite Dr. Catherine Kyobutungi back to the Global Health Unfiltered podcast to discuss the impact of prophets and so-called spiritual healers on the health of people across the continent and beyond. Catherine serves as the executive director of the African Population and Health Research Center in Nairobi and has decades of experience working in Africa to improve people's health across the continent. Welcome back to the show, Catherine.
Hi, Des. Hi, y'all. Thanks for having me.
So, I imagine, I know that you've watched the documentary about TB Joshua by now, the three-part documentary. And I must admit that I hadn't watched it until about 2 days ago. And I would love to get your reaction. What were your initial reactions to what you saw in the documentary?
Are we allowed to curse on this podcast?
We're gonna have to bring this one.
No, honestly, as I watched it actually the day it came out, and I watched the first episode, and I just couldn't wait to say that I'll watch the second and third episode. I don't know, whenever, because it was so disturbing, and I felt disgusted. I felt angry. I felt shocked. But I think for me it was if you put all the pieces together, it was how has something like religion, which is supposed to be a good thing, been so bastardized, and where people who are very smart people, I think, have decided that religion is their way of control and power and influence, and at the end of the scale, there are these poor people who are being exploited and being abused, and for them they are doing it because religion is a good thing. But on the other side, you have this person or these people. TB Joshua is not the only one. There are people who have decided that this is a way to get power, to get influence, to get wealth, and it's religion, which is it shouldn't be that. It shouldn't be that way. Religion is supposed to be something completely different. So for me, it was the ability of really what I would call bad faith actors to manipulate people who are doing something that they think is good, but the people doing this have no good intentions, and that they're able to get away with it because they've sort of embedded themselves in the political structures and power structures, and they can literally get away with murder. But for me, I'm always seeing the other side, seeing these people who come with faith and hope and whose sort of worldview is grounded into the good that religion is supposed to bring to society, and then being so callously exploited by individuals. For me, that's what's very disturbing. Yeah, but I was disgusted.
Yeah, I think you raise an important point because Africa is one of the most religious continents in the world. People's faith is incredibly important to them, and I think a discussion of this we have to also respect that there are many people of faith, different kinds of faiths on this continent, and faith is central to identity for a lot of people. And so, in watching and seeing the discourse about this, I've always tried to hold, as a scientist, as somebody in the health sector, I think we have to be sensitive to how we approach it because we don't want to, as Catherine said, it's bad faith actors. They are these people who are taking advantage of people's religious beliefs. You could have another discussion about religion and health and the intersection and all of that. But I think this particular discussion is about somebody who was a charlatan, who was a false prophet, who took advantage of people's religious seeking to enrich himself and take advantage of people. But having said that, I think the response has been, it's not been uniformly negative. I mean, there have been people who have reacted quite, against the documentary producers and saying how this is besmirching a great man's name. So, I mean, I know, Catherine, if you have any response, why do you think the response has not been sort of uniformly against TB Joshua, and instead he still has so many defenders, not necessarily even just within his own church, but externally?
Yeah, I think as you said, the response has been non-uniform. I think in the social circles in which I operate, actually it was overwhelmingly against TB Joshua, the social circles in which I operate, which was a little bit surprising, knowing that as you said, a lot of Africans are very deeply religious. But I think you could see narratives about, oh my God, I can't believe that this happened. And I used to look at this man and I used to respect him, and I can't imagine this is what was happening in the background. And then of course, I think that people have already moved and they can see through, all the bad faith that is sort of accompanies these kinds of religious groupings. So I think there's that group that already sees through that, and they came out right and said, yeah, of course, we're surprised that this is what's happening. But then, as you said, there's another group, which from my experience actually was much smaller. And they had almost similar talking points. It was almost as if there was somebody supplying talking points. And the first talking point was, why wait until the guy died? And later it turned out, actually, the investigation started much before the guy died, and he died after the investigation had started. Then I think another narrative was like, no, these people are liars. Like, why did they wait until all this time? How can you be sexually abused and you stay for 10 years in the same thing? And then is that even his daughter? That's not. So there were those things trying to sort of cast doubt on the credibility of the people who were interviewed by the BBC. So, but as I said, I think overwhelming, it was more like, oh my God, how could this guy do this, and how did he get away with it? But having said that, of course, I think in other circles, some narratives were like, it's not only TB Joshua. Then like, oh no, wait, my pastor or my bishop or my prophet is not like that. So, and I think for me that shows the hold that religion has on us as human beings. People of deep faith. This is something which can I would say approach people from something that is comfortable and something that is familiar and something in which they found community. So I think the fear of what would happen if I got out of this community is very big. And so people would rather deal with their doubts, take their time, and maybe bury the doubts, because for any difficult problem there's denial, and there's that whole I don't know how many stages people go through until people reach a point of like, okay, this is not right. It takes time. And so some people, I believe, are in those early stages of questioning, but I think you can expect that people are afraid. You can't just jump ship into the unknown when you've had sort of comfort and community and fulfillment in a community around that is revolves around religion. So I think you can understand, how people would do that. And then, of course, I think within that category of people who were against the documentary, they are the same bad faith actors. This is their bread and butter, and if that whole system collapses, they lose power, they lose money, they lose the hold they have over people. And so I don't think you discount that those are also at play.
Yeah, it's very understandable that religion is your faith. It's a very foundational thing, and anything that there's to question that is almost it's very adversary. People are less likely to even consider anything that questions their faith, especially when you put it in an individual like TB Joshua and the many other prophets. I was just right before the podcast, I was watching a video by about the prophet Passion Java. I don't know where they get these names, but there's a prophet Passion Java who just was arriving in Zimbabwe, and the motorcade, his arrival in Zimbabwe was just like, you imagine that it's Davido or somebody that is coming. And it's just amazing how people embrace and believe in them, and questioning anything that would question that, it would be really troubling to them. But I'm curious, Catherine, we don't seem to see as much of this type of faith healing, or, in the US, certainly it's common to see televangelists, not as common as it used to be, but it's still common, but definitely not as common as in Africa. So why do you think this is so prevalent in across the continent?
Yeah, I mean, I think some people have argued that the reason why Africans are so religious and people of faith is because hardly anything else works. So you don't have a job, you don't have, you don't have school fees for your kids, you don't have money to get good care. You go to a health facility and there are all sorts of things. Maybe there's nobody there, or you don't get healed, for something that you've gone to seek care for. And so you find other ways of, getting by. So I think people have made that argument. And actually there are other arguments which say that when Africans leave the continent and they go elsewhere, they become less religious because everything they used to pray for is there because of the way the system is set up. So I think there's people find ways of solving their problems, and you can't rely on one way of solving a problem. You try different ways, and then the problem is solved, and sometimes you don't know which way actually worked, but you keep all of them because you don't want we're always afraid of the counterfactual. If I don't pray, what would happen? If I don't go to church, what would happen? You don't want to know that. Suppose hell is real, so there's all that. We don't have counterfactuals about certain things. And so we sort of, continue doing that. So I think that's more like an effect, and a contextual factor in the African context, that there are not many good social services, and therefore we find alternative ways of solving our problems. But then I think, as all of us would know, religion, as I think is Yo who said this is something which is foundational. We are socialized from a very, very, very early age about the role of God and the role of religion in our lives. And so it's not unexpected that we see solutions in religion. I think even though the systems were functional, there will still be a place for religion in our day-to-day problem resolution, because the socialization is very strong. It starts from an early age, and since almost everyone has been socialized, you can't escape it. You go to school, they want you to pray. You have to go to church on Sunday. If it's boarding school, there are certain things you have to do. You come out, you go to your workplace. There are places where you cannot start the day without praying. You can't start a meeting without praying. So it is constantly reinforced in our lives to see God and religion as a solution to many things. And so it's not, I think, unexpected that people would find solace in the church or in the mosque when they are confronted with even health challenges. Yeah.
I had a cousin who once told me, he's here in the US. He once told me that when he's back in Cameroon, he definitely believes in demons and all of the voodoo and the crazy stuff that happens. But then when he's in the US, he doesn't believe that, which
Yes.
it just boggles my mind. Like, and this is an educated man who believes different things in different places. And so it's just
Yeah.
fascinating that you mentioned the fact that oftentimes when people travel overseas, maybe it's the fact that the systems are more functioning, that they become less reliant on
Reliant.
their faith to provide certain necessities in life, like healthcare.
Yeah. And I mean, I think it's interesting when you're talking about your cousin. So I stay in Kenya, and I think in our extended family, I'm one of few people who are not in Uganda. And then when I visit Uganda, you hear people's experiences, you hear people's something they live on a daily basis. and it's their reality. And as I've said, I think we don't want to test, you don't want to tempt fate by saying, I don't believe in this or I don't believe in that. And if that's your daily reality, you can't escape it. So sometimes I'm like, oh, maybe there's something there because, but since I don't live that reality, I can step in and step out. But there are people who are there constantly. So for instance, if people believe in witchcraft, and their daily experiences sort of revolve around that, it's hard to say that's nonsense, because I'm not them, I'm not there, and it's their reality. And since I don't live their reality, I can't discount it, I can't minimize it. And so much as I may not have that belief that things can happen, I don't know, maybe they can. And as I said, when people are afraid about the counterfactual, because you can discount it, suppose it's true, you don't want to test that, because testing the counterfactual could mean that you die, and then there's nobody to tell you a story that actually it was true. So that fear of suppose this was actually correct, suppose this was actually true, I think is quite strong, and therefore I leave people to their faith, and I have my own faith, and yeah, and we go on, life goes on.
Yeah, I think that's a really interesting point. I think, and perhaps that's where science and health in Africa is failing, in that we don't interact. We don't, science, many of us scientists are trained in Europe, North America. We have sometimes secular views when it comes to science. We may be people of faith ourselves, but we don't mix the two. It's like when you're in your science, you're in your science, and it's rational and logical, and then you may have faith, and you do handle that differently. But because we are trained in Europe and North America, and we typically professionally interact in that space, we don't have to confront religion in a professional sense, because typically in our day to day, in our circles, wherever we work, it doesn't creep in. But perhaps for African scientists and health practitioners, we need to engage more with it, because the people we seek to serve, are their lives are intertwined with their religious beliefs. And so the majority of people would not have the same worldview that we might have, or the same dualism that we are able to establish. For them, everything is integrated. And maybe that is where we allow people like the TB Joshuas to begin to take advantage. So, I mean, I'd be interested to get your take, Catherine, in terms of what can African scientists or African health practitioners, people operating in healthcare in Africa, what can we do better to counteract some of these things that these false prophets do? Because the church historically has also been a source of great good for healthcare. Many hospitals in Africa were started by missionaries, right? We cannot discount the fact that Catholic priests and nuns and church workers throughout our colonial past especially provided healthcare, and many of the hospitals are still named after some of these people who I think were very well-meaning people who did a lot of good things. So religion has had some good effects on people's health historically, but now we have this proliferation of so-called healers and prophets and people who may have ulterior motives. So how does the African scientist, how does the African doctor engage with the African population to help them, and perhaps even engage with religious bodies? But I was just curious what you think we are not doing that we should be doing better to begin to counteract the TB Joshuas of this world.
Yeah, I think that's a difficult one, because when I ask myself, who is the African scientist, who is the African healthcare worker, who is the African doctor? Because there's a healthcare worker who is somewhere in the middle of nowhere running a health facility, who has to see 50 patients every single day, and then perhaps go to the field to vaccinate babies and do all that stuff. So there's a systemic problem that doctors simply don't have time, or nurses don't have time to engage the same way that TB Joshua would engage with somebody who has come to them for help. And I think that's one way of looking at it. The other thing is that the people in churches, or the pastors or the bishops, are very consistent in the way they interact and engage with their clients, if I could call it that. They don't put on a hat and put it off. It's the same hat of, they have a consistent message, they have a consistent way of communicating, and they communicate about something for a long time until it becomes sort of embedded in people's thinking and psyche. Doctors don't do that. They'll call you to talk about vaccination on TV, and then you speak and go back home, and you'll never talk about vaccination again. They ask you to talk about cancer because it's World Cancer Day. You go and speak about cancer, and then you go back home. Because in your day-to-day life, the way you interact with society, you don't have the consistency and the time and the commitment to engage, about cancer as you understand it. So if you go on TV and speak and go home, how many people watch that TV show? Maybe 50,000 in a country. But the people who interact with the TB Joshuas of this world, they are consistently bombarded with the same message about certain things. So if there are 5 messages, by the time somebody interacts with it within a year, they get it. But for us, it's hit and run. It's hit and run. And I wouldn't blame the doctors. I don't think the system is set up in a way that doctors have the time to do that. But on the other hand, the way doctors are trained, the way healthcare workers are trained, we are trained in a certain way. We see things, in black and white. It's yes or no. It's you have diabetes or you don't have diabetes, and I think somehow that training, which is Eurocentric, takes away the other elements of disease and health and spiritual well-being and well-being generally. And so by the time you finish, you discount them. And yet the patients that we see, the people that we interact with, are in that world. That is part of their world. So our ability to incorporate that in care and to acknowledge that there's a role for them and not see it as either or, it's either religion that heals or it is medicine that heals, not looking at it as an either or thing. And so we are not trained, we are not oriented in that way. And even outside the issue of religion, I mean, there's something else about traditional healers and all that. Doctors are not trained to engage in a way that is respectful with other ways of knowing, other ways of thinking. They're not trained in that way. You have cancer, and that's it. And this is what is going to happen. If somebody entertains the notion that, oh, I think I'm going to go to my pastor, then you're very stupid. Well, why do you think that? Rather than, yes, I understand, and we can all work together on this. So there's a problem in our training, there's a problem in our orientation, there's a problem of time, there are time constraints, and then there's a problem of lack of consistent messaging. And as I've said, it's not just about religion, it's about everything else. A mother comes to a healthcare facility, they have 5 problems with their baby, and the doctor picks on one, go to the lab, get an injection, take this medicine, go back home. And yet the mother had hundreds of questions that perhaps were relevant to their child. And that's a missed opportunity. If that child doesn't get better, the mother will go to another healthcare provider. If they go and they get the same kind of treatment and the child doesn't get better, they'll go to a place where someone is going to sit with them for an hour and listen to them and visit them at home and then check on them. And then when they come, they respect them, they listen again. So they will gravitate towards that kind of setup. And that's why even outside the dichotomy between faith and Western medicine, even within Western medicine, that's why there are quacks who thrive. Somebody doesn't have medical training, they set up a facility somewhere in the village and they're very popular because they are respectful, they take time, they follow up on patients, they call them, they explain, and they take away people from now the non-quack establishments, because the non-quack establishments, people are harassed, they are busy, they are stressed, they are not well paid. So there's a lot that's wrong in the healthcare system. And so it will take really a lot to shift the orientation and then see all these forms of knowing and knowledge as things which are complementary rather than, other than contradictory or something like that. Yeah.
I can't help but think that the weight should not only fall on the shoulders of healthcare workers and scientists, and I agree with you on that. It seems to me that theologians and those who deal in this space of the mystical and have a much larger role to play. I think back at my own kind of evolution in my thinking on faith. Excuse me. Here in the U.S., I went to a very conservative Christian school. I came in with a very strong faith. And I remember studying biology where evolution was being taught. Within this conservative Christian university, right, the Bible department and the biology department were very much at odds with each other. And I remember my biology professors really just kind of sitting down with us in the courses and kind of trying to get us to understand how we can reconcile our faith with the science that we're learning, the foundational science that we're learning in our courses, to dive a bit deeper to understand that these things, they don't necessarily need to be at odds with each other. Why do they seem at odds with each other? So that was very helpful. Just having, I mean, in that case, those were professors that helped me, but there were also, I actually had a mentor who was a Bible professor that I would have lunch with almost on a daily basis, and he would on a weekly basis. And so I would meet with him and discuss and say, oh, we're talking about this concept in biology. What do you think of that? Right. And that dialogue between the science part with my science professors and the Bible professors really helped me to kind of make sense of it. So I wonder if our educational systems have such a big role to play as well in just getting people to understand, the basics of the science and how you reconcile it with this foundational faith that people have.
Yeah, I would say most definitely, and I think in two ways. I think one way is what you've described, that is there a place for a department within the same educational institute as I said, to help people reconcile those things that seem at odds with each other. I think that is something which could be which is possible. I think what we have currently is that if there's a department of theology, which is quite unusual. You can't find like a department of theology at Makerere University, University of Nairobi. The schools of theology are separate completely. And if there's any department of religion, it is that they run the church services on Sunday, and maybe they go and pray for patients, and they have some kind of outreach ministry. But the interaction with people who are learning doesn't happen. Or maybe they come in when they're talking about ethics or something like that. So there's no systematic attempt, as you said, to reconcile those two disciplines or ways of thinking. That's one way in which the education system could help. But for me, fundamentally, I think the education system should be one that enables people to do the reconciliations themselves. That you're trained in a way that you can get one piece of information, get another piece of information, and you have the capability and capacity to interrogate those two different sets of information. You're able to read on your own, find more information, and over time form your own worldview. But I think our education system does not necessarily allow that, because you've probably trained in these countries. It's about get facts, spit them out on a piece of paper, on a computer, pass an exam, and like go through this narrow path of absorbing lots and lots of information, and then regurgitate that information to prove how much you absorbed, during the teaching and during the learning process. And it's not a system that allows people to question. It's not a system that allows people to interrogate, and it doesn't allow people to find alternative sources of information. The teacher, the lecturer is an authority, and we are socialized and trained to see them that way. And so when you come out of school, then you go to church, and then there's the pastor, and there's that. And so we are trained in ways that are very regimental, and doesn't allow us to question these things and maybe try to reconcile them ourselves. And I think that's fundamental. Maybe that would be better, because it can be much more widespread. If our education system is turned on its head, that it produces people who can really think for themselves and then come to their own conclusion about what it is about them and what do they believe. There's no right or wrong belief. But at least you should be comfortable with that and not being boxed and fearing to even look outside, because if you look outside, then you might be seen to be a certain way. So I think that's where the education system could help, really training people who can reconcile different pieces of information and come up with, their own view of the world.
Yeah, no, I agree. I mean, I think this topic is quite personal for me because both my parents are theologians, and my younger brother and I are both scientists. So in our house, you had two children who grew up in a house where theology was spoken all the time. In fact, my father was a very prominent African theologian, very well known for for how he viewed Christianity in Africa. Um,
Mhm.
but I think what my parents did was they created an environment that you produce two PhD level scientists who are doing very well in science because they embraced discussion. It wasn't that science or theology. It was
Mhm.
theology is a worldview and a way you think about the world, and science is another, and you can actually interact. And I think, Desmond, what you
Mhm.
described is sort of a liberal arts, US liberal arts type education, which is also what I had in college. I also went to a very conservative Christian college, but there actually they taught evolution not in conflict with what the religion professor said. You were actually engaging with it. Um, and I think what Catherine is talking about, that system actually is allowing you to confront, appearance of conflict, which may not be conflict. And I think that is what
Mhm.
a good education does, whether it's religion and science or other things. We always confront things that appear initially to be in conflict, but with dialogue, with introspection, you can find lines where there is intersection and where there is room for dialogue and for understanding. And I think it was when we did the podcast with Professor Iruka Okeke where she talked about how Africa's our colonial education system produced people who can function in the colonies, right? So they wanted people who could be clerks and registrars. It was not producing innovators or thinkers, right? If you think too much, you want independence. So they create robots. And we've not changed. So our education system is regimented. You're a science student. I mean, we get to specialize way too early. You have either a science student or an art student out of like halfway through high school.
Mhm.
That is terrible. You should have artists who become scientists and scientists who become artists. So I fully engage with that, and I think this TB Joshua example perhaps is almost it's an effect of a system that has produced people who may be very intelligent but are not able to interact with different spheres and different worldviews, and so are
Mhm.
vulnerable to manipulation by people who are smooth tongued and are able to twist people's beliefs. So I guess the question then is, how do we, how do we move forward? I mean, we do need more interaction. I agree. Doctors don't have time to engage, but I think the term we use, spiritual healers. Does our medical profession, are they healers or are they treaters? Right? They treat your disease, but they don't heal you. Whereas the pastor is seeking to heal you and is addressing many other things. Maybe the baby is hungry
Mhm.
because mom doesn't have money to pay food. It's not just that the baby has malaria. And is the doctor going to recognize that? The pastor probably will, because the pastor will talk to
Mhm.
you. And so I guess the question is, how do we move forward? We know what the problem is. How do we begin to address this so that our populations are less vulnerable to manipulation? But perhaps how do we engage with well-meaning religious leaders? I think we shouldn't paint all religious leaders and theologians as negative. Obviously, I may be slightly biased given my disclosed background. But how do we engage? During COVID, I think it was the Church of Pentecost in Ghana was instrumental in getting people to get vaccinated, because the head of the church came out and said, I got vaccinated and you guys would be silly not to. Yes, we pray for God to
Mhm.
protect us, but go and get vaccinated as well. How do we engage with these people to use their influence actually for good, and then distinguish them from those who are clearly just in it for their own ends?
Yeah, I think, I guess the question would be whether this should just be about health, or whether it's in general. And I go back to the consistency of messaging. What do we want as maybe medical practitioners? What do we want as health practitioners? Because it shouldn't be like, let's just address this thing and then move on. I think it goes back to that consistency of messaging. And I'll just give some examples about how, the established the Western medical establishment gets beaten at something they should be good at by, as you said, faith healers, but also quacks and others. Um, in where I come from, there are people who are bone setters. I don't know whether that happens in your own culture. There are people who are known as bone setters, and it's like a lineage thing. It's something you inherit from your fathers and all that. So it runs through families, and not anybody can wake up and say we are a bone setter. So, for instance, where I grew up, we know a family which was a family of bone setters, and even up to today, everybody knows that is the family of bone setters. Now, when you go into a hospital and somebody comes with a fracture, in medical school they teach you that different fractures, depending on the size of the bone and the location, they take different time frames to heal. So, the smaller bones take faster, the bigger bones take longer. And so I think the big examples are for the big bone in the thigh, the femur. That fracture, we were told, required, those many years ago, required 12 weeks of immobilization. So they would take somebody to theater, they pull the bones which have sort of separated, they put them together, and then they fix them with screws. Now they don't do all that. And then when they fix them, to make sure that the fracture doesn't move again, they would put people into some kind of thing that held them immobile. And it was supposed to take 12 weeks. And after 12 weeks, they do another x-ray, and if the bone had sort of come together again, then they would remove that whole apparatus, and the person would get a cast. And then about 1 month later, they would almost be good to go. So it would take about 4 months on average for somebody to sort of be back on their feet, or at least using crutches, when the fracture has healed. Now, when people would come and get admitted with this whole elaborate apparatus, it was very painful. And of course, as people had to stay in bed, they couldn't get up. The screws were painful and all that. People would tell them, no, if you stay here long enough, the leg will be amputated. So it wasn't uncommon for people to cut those elaborate apparatuses in the middle of the night, and they take these patients to a bone setter. You meet those people 1 year later, they're still there, patient, but they were not patient to spend 12 weeks in a hospital. 12 weeks was too long. If the person had been there for 8 weeks, they told them they would just run away. And then they would go and spend a whole year patiently without complaining. And then, of course, all sorts of things would happen. Some would get infections. Sometimes the leg will heal, but bent, and the person can never, walk properly again. But they were okay with it because they had been convinced that the alternative was to have an amputation. Even though that was not true, it was almost unheard of for somebody to be amputated because they got a fracture of the femur. Almost unheard of. But people believed that strongly, and they believed the bone setters, and they were patient with the bone setters, but they were never patient with the Western medical establishment. So what is the problem there? I know people that you would meet 1 year later and they are walking with a limp because the leg had healed in a way that was bent. Even for the smaller legs, the smaller bones. And so you'd ask yourself, what are we not doing right? That people can go and wait for a year, and they couldn't wait for 6 weeks for the same fracture. So is it because we've raised expectations so high that people expect miracles? It's the same with cancer. People will come, and then they'll be told, you have cancer, you need to do X, Y, Z, and they'll say no. Then they'll go somewhere else, and then they'll come now with stage 4, like terminal cancer, 2 years later, because you couldn't keep them at that time. They went somewhere else, and they were patient for 2 years, and now they're coming, but they couldn't wait for 3 months or 6 months that we were supposed to spend in the Western establishment. So I don't know that we've raised expectations to an extent. People think that Western medicine is one that performs miracles, and so when miracles don't happen, then people seek alternatives, where perhaps the way the alternatives have been framed and pitched, they're not promising the same level of miracle that is promised in the Western medicine. So I think there's that. Like we are really getting it wrong when it comes to communicating about care, about prognosis, about progression of disease, about all this. And so other people have come in to fill that vacuum. And they fill the vacuum in a way that is not usually helpful. There are some things where you know that as night follows day. If you've been diagnosed with cancer stage 2 and you don't get the right care, as night follows day, 2 years later, you'll be back with stage 4, maybe even earlier. But there's no way of even tracking, like those people who went to bone setters, we don't even have data to say what happened to them. How long did they stay? What was the outcome? We don't know that. people just run away and they get lost to the system. So I think we are missing an opportunity to, first of all, document some of those things, but then also manage expectations and being more intentional on how we explain that that Western medicine does not promise miraculous cures, that there are prognostic factors, that there are other things, there are different outcomes. You can be healed, you may not be healed, and I think we have to do that. What alternative do we have? That's the thing. Like, what do we want as healthcare providers? What do we want as doctors? Do we want to just be there as demigods that dictate and hold all the cards in our hands, or do we want a healthy population? And if you want a healthy population, then we can't run away from, doing what the population expects of us, or what the population gets, from other, from other providers of health. So we can't run away from that. And we can complain about how busy the system is, how overwhelmed doctors are, but sometimes we are overwhelmed because we didn't take time at some point in time in the past. A woman comes when they're pregnant, we don't take time to explain vaccination and nutrition and family planning. And then they come when they're pregnant again, when their other baby is 1 year old, and we deal with that pregnancy. And so we don't realize that the fact that we don't spend time at a certain time in the past is actually what's driving the fact that we are overwhelmed in the future and in the present. So as I said, we have to ask what we want. If we want a healthy population, then we don't have too many options. We can't keep on doing the same things over and over again and expect different outcomes. So our orientation as healthcare providers, our orientation as, scientists has to change. And of course, this is putting the burden on us as individuals. Then, of course, you have to ask yourself, what can governments do? The people who design curricula, what can they do? That's a different story altogether, because sometimes it's difficult to operate in a dysfunctional system. So, but I think all of us have a responsibility to do the best that we can.
Well, I have some experience with bone setters. I've not been to a bone setter, but I had a car accident a few years back and broke my femur. Excuse me. And I was advised to go to a bone setter. My uncle told me that these guys are very reliable. They're good. And I, being someone who works in global surgery, believe quite the contrary. And so I found the best orthopedic surgeon I could find in Yaoundé to operate me. And yet I still got an infection and, got osteomyelitis and had to get 2 additional surgeries after that. And so I'm guessing in his head, he was probably thinking, well, I told you.
I told you.
I told you so. But we don't know, like you say, we don't know what the alternatives are, the stats for the bone setters and all of that. There are some governments where they're actually working with bone setters to educate them, to train them, because they do provide kind of healing that people that have gone to them and they've it's really basic, right? It's just aligning the bone and keeping it in one place. But there are a lot of other like you say, they end up staying there for 1 year, the bone gets healed in the wrong way and all of that. So but Catherine, I'm curious. My other question is, I want to talk a little bit about accountability. There are people that have been hurt by TB Joshua, their lives that have been lost and continue to be lost by his disciples in Cameroon, in the UK, in Greece, right? There was an article by Open Democracy that talked about how his disciples continue to do this around the world. People have lost lives. People have lost their loved ones. And so, and I can't, we're talking a lot about education and changing the mindsets of people. And that's a very long-term strategy. But I'm curious, how do we hold people who continue to exploit, I would say, the vulnerable in our societies. Who holds them accountable? How do we hold them accountable? Because
Yeah,
it
I think
needs
for
to
me that
happen.
was
Yeah.
it does, and I think for me that was the most maybe infuriating thing about all this. What has happened since this documentary came out? What has happened? Is there any legal process that is happening in Nigeria by the government? I don't think so. And so because these bad faith people know exactly what they're doing. And there were all these clips of this guy meeting of presidents, I don't know, presidents of how many countries. And there were clips of the previous president coming to condole with him after the tragedy. Just imagine that. Hundreds of people have died, and your first thing that you do is we've come to offer our condolences to the prophet, not to the families of people who died, no, to the prophet. That's what the president of Nigeria came to do. So that what is infuriating is, unfortunately, I don't think there will be accountability. I don't think so. Because if there was to be accountability, maybe by now there would be a process. It didn't need the BBC to dig up all these things for accountability to take place. And so I think for me, what maybe one of the good things that this documentary did is to open people's eyes that these people can get away with something, and it will be you, it will be your relative, it will be your friend, it will be your neighbor that will have suffered the consequences. There's something happening in Kenya. I don't know if you've heard of the Shokahola incident, where almost, I think now there are probably around 400 people who have been unearthed from graves around a similar facility. And actually, based on witness accounts and all this, these people were asked to fast, and some of them starved to death. But now it's turning out that there were many other deaths which had nothing to do with that whole fast until you die kind of brainwashing. And what happened? It made headlines. It became like this whole thing, and then the government said, "No, we are not going to allow media anymore. You can't report about this anymore." And so now whatever is happening is being done away from the media, and we've all moved on. So what do you expect? Of course, the person, the pastor, bishop, or whatever is in prison. But what are the chances that this person will be convicted? And how do you convict somebody for the death of 400 people? Is that enough that one person is convicted? Who else was involved? Where was the local government? Where was the police? Where's all that? So that is what is infuriating, that accountability is difficult until people start seeing through this whole charade and this whole performance and this whole bad faith that we are seeing from from some of these bad faith actors. And actually the other aspect of this is how now bad faith actors from the political side are taking advantage of religion, and that's why accountability is hard. The worst political leaders are religious. Or they okay, let me say, quote, they are religious, quote unquote. People will kill, they will steal, they will plunder, they will loot, they'll be the worst corrupt people, and they'll go to church every single Sunday and pray. And they will put their hands on them and bless them. Because they know that they derive power by being seen to be religious. And now it's scratch your back, I scratch your back. The religious people know it, so they're in a symbiotic relationship with political leaders. And at the end of that is the poor African who is suffering, horrible service, corruption, hunger, poverty, unemployment. So there's like collusion between politics and religion, and it's so blatant. It's so blatant to see, and sometimes it's hard to see why people don't see that. Somebody like will even kill people, but they will be, in cahoot with a pastor, and then we forget everything. And we believe that this person is actually religious. Like how can we be so gullible about it? So unfortunately, it's hard to see how accountability is going to happen until that point when I think I have a lot of faith in human beings, that over time we learn, we grow, and there will be some kind of tipping point where hopefully we shift to the other side where people don't get away with these kind of things that they do. But that is something which is very far in the future. And
Yeah.
yeah, that's I think for me that's the sad fact.
Yeah, no, I agree. And I think when you think about accountability, I mean, look at human history. I mean, look what's happening in the Middle East right now. Look what's happening in Gaza. Where's the accountability for that? Um, I think, yeah, we look at it seems to happen a lot in Africa where people get away literally with murder. Um, and I think I believe their comeuppance will come. And I think I believe in Catherine. That people eventually people rise up and resist oppression of whatever form. But I do think going back to what can be done now, certainly from our perspective as people in global health and in healthcare, I think the one thing that perhaps we need to learn is a respect for our patients or the people we work with. I think listening to what Catherine was talking about, what we've been discussing this morning, where we fall down as quote unquote scientists is unfortunately maybe sometimes we buy into the colonial. It's not necessarily always just colonial, but we fall into that thing of these are poor people who don't know as much as we do, and we treat them as such. I mean, I think we each have to examine ourselves, when we interact with whether it's research participants or patients or whoever in the study and the work we do we see them, do we see ourselves in them, or do we pity them? Right. And I think where people, whether they are genuine religious leaders or fake charlatans like TB Joshua or bone setters or traditional healers, those people don't other the people they work with. They get in the trenches. They make you feel heard. They make them feel respected. They make them feel cared for. Whether it's genuine or not, the person leaves feeling that, wow, this person cared about me. And I think
Yes.
that is probably what is lacking in our Western educated, elite, almost elitist behavior. In that, yeah, we want to help Africa, but do we see ourselves there, or is it these people who don't know anything, and we are telling them we are the source of all truth, and we know that it's malaria caused by a parasite, and they are silly for thinking that it's some grandmother in the village who is doing me something, right? And I think that condescension is felt by these people, and so they won't be patient. They won't give you 3 weeks. They'll go, and actually
Yeah.
there's evidence demonstrating that people will go first to the hospital and then they go to the healer. They don't go to the healer first, they go to the hospital first because that's what they feel they should do. But based on their experience, they go elsewhere. I have an aunt who delivered 4 of her children at home because she had terrible experiences the first couple of times she went to the hospital. So she chose to deliver on her own successfully. I mean, my aunt is a force of nature, but she would not go to the hospital, and so instead did unassisted delivery at home rather than go to a hospital because she was so mistreated at the hospital. So I think maybe, yes, accountability is important, and these people need to get, justice needs to be sought. But maybe in our small level, at our level, we can take that responsibility to view ourselves in the people that we seek to serve and to place ourselves there better than we do, and show that respect and love, and maybe then our message will begin to permeate and people will be less vulnerable to the people who are seeking them harm but are dressed up, wolves in sheep's clothing, as it were. So just sort of
Yeah.
thoughts about that. Yeah.
And I think actually that also applies to us as scientists. The way we treat our study subjects and the study participants and study communities. And at the African Population and Health Research Center, we work with policymakers and we work with civil society. That many times our engagements are from a position of power and superiority. We are the scientists, we have PhDs, we understand these issues, and we're here to help you. And we know what your problems are, we know what the solutions are, so we're here to facilitate and help. And it's so pervasive, and of course it goes back to the way we are trained, and that is still going back to the colonial way of seeing, of looking at the world. So we still have a long way to go, where you're doing an engagement and you're there as somebody who maybe is an equal, or maybe even less. You don't understand people's problems the way they do. And so listen, pay attention, and don't come like this PhD holder with 200 papers on their CV and therefore know it all about that. So even I think from research, science, policy perspective, we still have a long way to go. And maybe that's why we have so many problems, and what we think are good solutions are not working, because we are not listening to the people that we think we are serving, we think we are helping.
I think that's a very sobering note to end our discussion on. Yeah, we've got a long way to go. There's a certain level of humility that we should approach it as scientists and healthcare workers. But I can't also help thinking that having conversations like this and documentaries like the one that BBC released will help to create a space where discussions can be had, because I believe that one of the best ways to stamp out bad ideas is to flesh them out and discuss them in the public spaces. And so I hope that, you know, at least this discussion gets people thinking and gets people talking, and hopefully that in the long term will help us to you know, really deal with this pervasive problem across the world. But really, Catherine, thank you so much for coming on the show. We've enjoyed having you again, and I believe we'll be having you back again shortly. Thank you so much.
Thank you, Catherine.
Thank you, Des, and thank you, Yo, for having me. I look forward to continuing the conversation.
Thank you.
Fantastic.